Hi everyone, this is Veronica and today we are going to discuss a topic that is relook on the Indian medical devices industry. So we will discuss this. For my video updates, you can follow me on Instagram and the PDF of this lecture you'll get on Facebook or my Telegram channel. So why is this in news? Because recently International Consortium of International Journalists, they recently published a report, or you can say investigation on Implants File investigation on medical devices. So what are medical devices? See, like you have seen the surgical lasers, right? You have seen catheters, you have seen sutures, pacemakers, stent, vascular grafts, heart valves. These kind of things constitute medical devices and a strict regulation on them is needed. That is why today we are talking about them, because Indian medical device industry is in serious need of examination. Why? We will discuss in this lecture. So what is ICIJ? First of all, let me tell you a little bit about this consortium. This is an independent Washington DC based international network. It was launched back in 1997. This is an independent organization and it includes around 200 investigative journalists and 100 media organization in over 70 countries, right? So they work together on issues such as cross-border crime, corruption, accountability of power. So here in this implants file investigation, what they decided together to investigate about regulation, faulty devices and corruption in medical device industry. Okay. I'm sorry. So let's see what are the concerns that was highlighted after their investigation. See, the investigation has revealed multiple signs of danger in regards with medical devices industry. The number of medical devices adverse events has gone up from 40, which were 40 in 2014, and they were reported to be 515 in 2018. So one instance would be deaths after installation of stents have been reported, and then there is a question of devices that have been recalled elsewhere. For example, as many as 117 devices have been recalled over the past 2 years by US FDA. US FDA is United States Food and Drug Administration. Okay, they recalled around 117 devices last year because they have led to adverse events, but half, perhaps more than these devices are still on the market in India. So medical device manufacturers are not following up on their responsibility to track down the recipients to whom they have given or installed these medical devices. So they also do not pay any compensation to the people if there is a fault found after installation of such device. Okay, so these are the concerns which are of lately highlighted. Now see, what are the drawbacks in India? We need to talk about India. Now the global withdrawals are not being followed through India. There are no particular regulations in this industry in our country. Not even any list is maintained by any regulator that which medical devices have been recalled, which are to be used, which are not to be used. So in this case, see, it is the responsibility of Central Drugs and Standard Control Organization, that is CDSCO. It has the primary responsibility to maintain all these things, but maybe they are not doing it with satisfaction. So even if regulators like CDSCO, they are not willing to take up this responsibility, or they are not willing to take action, they must at least serve as information clearing houses and broadcasters, because by this at least the recipients and their relatives or citizens concerned can take action on their own. Now see, the data which is maintained by the IPC, that is Indian Pharmacopoeia Commission, that is also incomplete. Why this is incomplete? Because the reporting standard in our country is very low, very weak. because the people who are concerned, they don't report which medical devices are in use, which have been recalled, so they do not react appropriately to the troublesome medical device, and thus problems may not be reported. So the close links between medical device companies and medical professionals are widespread, a variant of those between pharmaceutical companies and doctors. So you see, there is no specific law that allows government to direct medical device company to give compensation, because compensation is a big factor here, what recipients are demanding if in case they found a fault. Because see, if there is a surgery done for a stent maybe, or for some kind of implant, and later the recipient comes to know there is a fault in them, then they again have to do a surgery to correct the problems. So the patient has to bear the cost twice. That is why they're asking these company who sell these devices for compensation, and they're asking government to frame some laws so that the company should give the recipient some kind of compensation. So now see, what is the way forward? Now, a way forward, if you see, the medical device industry is basically a unique blend of engineering and medicine. It involves creation of machines that are then used to support life. If you see ventilator, or if you say any x-ray machine, or if you say MRI machine, most of the things. So you see, there is a blend of engineering and medicine, they work together. Moreover, so quite strict regulations are needed. Next thing is about a careful regulation and highest ethical standards. Now recently, if you heard in the news, the government said that they will introduce the subject ethics for the medical students, but then there was a hue and cry from all over the community that why the subject is being introduced. Ethics is something, some people even argue ethics is something that cannot be taught, but it is not like that. Ethical standards can be increased by teaching this community some kind of ethics which they already have, but we need to boost or endorse this ethical system. So large and vibrant public sector in tertiary healthcare is essential. This is possibly the way to counteract the hurtful consequences of information asymmetries and poor regulation. Now the government should re-examine its plan for universal healthcare at this juncture. Now see, there were some implants done where the investigation was again going on, or we can just talk about some laws governing the medical devices in India. Early only 10 medical devices were regulated in India. Later this has since been broadened to 23 categories in India. We will now just move to the next slide. Now just see, in India there is last year only medical devices rules have been set up in 2017, which are implemented from 1st Jan 2018. Now government is talking about to add the compensation thing under this rule. If you have heard the famous Johnson and Johnson case, right? Johnson and Johnson hip implant case. What happened? See, there is a hip replacement treatment. Okay, what hip joint is there? Hip joint consists of a ball and a socket, right, which are covered with cartilage, and it is surrounded by lubricating membrane to protect against wear. So when you have to go for hip replacement, all components are replaced with prosthetic components. What are prosthetic? The artificial components. These artificial components, they consist of metal on metal, or there are elements like cobalt, chromium, molybdenum as major constituent. These were being manufactured and sold by this particular company, Johnson and Johnson. Now what happened? When the prosthetic ball and socket rub against each other, they cause wear and tear. Now if the implant is metal on metal, this can sometimes releases metallic debris into your bloodstream that could be highly dangerous. Therefore, a revision surgery would be needed. Now, because of this, many patients complained about this wear and tear. Now, Johnson and Johnson recalled their product in 2010. Now, see, what are the concerns with Indian patients? By then there were around 4,700 such surgeries in India, and we were able to track only 3600. We were able to get in touch with not these 3600 people. We cannot get into touch with, right? They could not be traced. The committee sent letters to 101, from whom only 22 people responded. So you see that in India we have no track and record for such activities also. So if there are any recalls from the global world, we cannot at the same time, it's very difficult in India to inform it to the recipients or the citizens who are using such medical devices. So there are now recommendations from government panel also, which we can talk in way forward, that amid concerns worldwide, the health ministry should set up some committee to examine the issues like this, and they should revise the medical device rules also, and the agencies which are responsible, like CDCO, that is the and the IPC, that is Indian Pharmacopoeia Commission, they should be given some more resources and a clear mandate that what they have to do to regulate the medical device industry in our country to avoid such problems and serious adverse events, right? So even you can write what they can do for this medical industry which lack such regulation. So this is all about this. If you have any queries, you can contact me. Thank you.